Good evening, listeners. A warm welcome to Views on Health. As yet another Monday evening comes by, it's a great pleasure to have with me on the program tonight Dr. Shania Gunasekera, consultant neurologist at the Institute of Neurology, National Hospital of Sri Lanka. A warm welcome to SLB Sena Studios, Doctor.
Hello, and thank you very much for having me here.
Pleasure. And for the information of our listeners, Dr. Shania Gunasekera is going to focus on a very interesting topic. It's all to do with one's sleep. It's sleep neurology. A technical term. Over to you, Doctor, to introduce the topic.
Yes. Even though sleep neurology might sound a little technical to you, I think majority of us might be having some kind of a sleep issue, because it has been found, particularly in West, that as many as, say, 20% of the general population have some problem pertaining to their sleep. Unfortunately, we don't have statistics in our country, in our setup in Sri Lanka, but I'm sure many of you might be having some problem related to your sleep. So those problems can come in a variety of forms. You might not even know that you have a sleep problem.
So, Doctor, would you say that now if I don't sleep continuously, I mean, occasionally we might have a bad night, but if I'm right, please, if I'm wrong, please tell me also. When you speak of sleep neurology, it is like something that continues and therefore needs to be addressed medically. Am I right?
Exactly.
So in which case, if people do come to you with this situation, but they find for days on end or nights on end, they can't sleep, and then it impacts on their lives. Naturally, the next day might be walking around like a zombie, or can't focus on things, and depending on one's age, it can really have detrimental effects on one's life.
Absolutely.
So, Doctor, can you continue? So, therefore, how does this go?
Yeah. So anything can become a disorder when it comes to disturb your normal life. So as long as your sleep habits and your sleep related issues are not interfering with your day-to-day activities or day-to-day life, it will not be a disorder and you don't have to seek medical attention. So the day you feel that this is really interfering with my daily work and the quality of my life, at that point it is a disorder. So that is how you identify if your sleep pattern or if your sleep related behavior is disordered or not. So it is not only about lack of sleep. So sleep neurological disorders are many. Just to make it very simple and categorize, of course the commonest one is insomnia, or in other words, lack of a good quality sleep. Okay, so sleep should be of adequate quantity. That means adequate number of hours. At the same time, the sleep should be of good quality. Actually, even though you can sleep for say 8 to 9 hours, if your sleep is interrupted a lot and if you wake up on the following morning very unrefreshed, you may not have had a good quality sleep. So insomnia or lack of sleep means not having adequate number of sleeping hours with a very good quality. So sleep disorders are not limited to insomnia, or in other words, lack of sleep. There are so many people who are having excessive sleep because they are always sleepy. So they are so sleepy to an extent where their daily activities are very much interrupted. So that's one category of sleep disorders, which is of course commoner than you think. And then we have sleep-related breathing disorders. That is, you may have noted that some, overweight people might be snoring a lot at night. So even though we are inferring that to something very normal, so people do snore, but actually that might be, the beginning of a lot of other problems, which I will be discussing later on. And then we have some funny other problems like sleepwalking, sleep talking, which might sound very simple to you. But in some people, they are so severe that they have actually posed a lot of challenges to them. And then we also have circadian rhythm disorders, which I will discuss in detail. That is, for example, jet lag. right? So when you have had a flight of about say 12 to 13 hours, and then you are crossing the time zones, of course the following day you might not feel well at all, and your entire sleep routines may be totally jeopardized. So sleep problems can be, very simply categorized like this, but it's very sophisticated, but I'll try to make it as simple as possible to you.
Thank you, doctor. So it's interesting. Yes, it's just not lack of sleep, but excessive sleep, like you said a while ago, as well as other reasons why your sleep is impacted, especially after a long flight, a long haul.
That's right.
Some people recover fast after jet lag. Some people take days. Even
Exactly.
as long as a week, somebody has told me, and you just wonder how or why. But then that, I guess, it's like it sort of depends on each person's. I mean, I would think the way he or she can um, fit into these time slots, time zones, the changes. Some come after a long flight and they're back at work. They're perfect, more or less.
Yes.
But others are not.
That's right. I think that depends on your genetic makeup. And something interesting about human brain or the human body is we have a biological clock in our brain. So this clock decides when I'm going to wake up, and when I'm going to sleep, and then this is my daytime, and this is where I should be active, and this is the night time, and this is where I should sleep. So that is something really amazing. It is with the humans as well as with the animals. So when a baby is born, the baby's brains are not mature enough. So they don't know when to sleep, they don't know when to wake up. So at 3 a.m., 4 a.m. in the morning, they just wake up and cry thinking, okay, now it's time to play. But when we mature, the biological clock in our brain also matures. And then we set up our own timetable throughout the day. That is why we are very fresh and we are very active in the daytime. And by 7 o'clock, 8 o'clock, 9 o'clock, 10 o'clock, we tend to get sleepy, and then we go to sleep. And then for good 6-7 hours, we are sound asleep without waking, because your biological clock says, okay, it's time to sleep. So that is what we call circadian rhythm. Circadian rhythm, of course, the brain is only one organ related to that, but many other hormones in our body, our gastrointestinal system, everything works according to this circadian clock. And then the disruption of this, perhaps due to crossing the time zones, or maybe shift workers who are sort of, staying awake at night shifts and sleeping in the daytime, this circadian clock can get disrupted. So that is when they just start facing a whole lot of sleep-related problems. And just to add a little more to that, so all these external stimuli, how is this circadian clock is kind of, the the adjusted, that is. So in the daytime we have, when we wake up, we see the sun we call it Zeitgebers, actually the sunrise and the colors and the lights and everything. So basically we take all the inputs through our eyes, through our nose, through our ears, and all these 5 senses. So our brain realizes, all right, this is the morning, this is the daytime, and then towards the evening, the atmosphere starts getting cooling down, and then the sun goes down accordingly. Our brain gets all the external stimuli, and there are some internal, hormones happening, and accordingly the circadian clock or the biological clock is nicely set.
A question, doctor. How about
Yes.
those who sleep in the afternoon? They sleep in the night.
Mm-hmm.
They are active till lunch or a little thereafter, and then they nap in the afternoon. Some do it as a habit because they have the time. They're not working. They're at home. If you're working, definitely you don't have that, no time for you to even think about sleeping. But some do it occasionally. They don't sleep every afternoon. Could you comment on that, please?
Yeah, evening nap might be refreshing to some, because even though we think that sleep is actually a period where our entire body is completely inactive, that is wrong. Sleep is where a lot of, we are actually metabolically active, our brain is active. It is during that sleep that our body recovers. So perhaps after a very tiresome day, having an evening nap will be very refreshing to you. So of course, evening naps are never discouraged. But if you nap too long, so much so that it is interrupting your night sleep, of course, in that instance, you have to think about, probably cutting down your evening nap to a maximum of 1 hour. But of course, having an evening nap every now and then might not disrupt your biological clock or anything, as long as it is, short, and it is actually a nap rather than a long sleep.
Thank you, doctor. So going on from there, how does this lack of sleep, excessive sleep, other factors all coming in affect a person?
Yes. So if we come to the lack of sleep, insomnia, which is the commonest, of course, it is actually something pretty difficult and very disruptive, because, as I told you before, it is during the sleep that our body rests. Of course, even though our body is not completely inactive, it is during the sleep that our brain rests, and at the same time, our memories consolidate. What we learn during the day becomes nicely stacked into our brain, different compartments of our brain. So everything becomes basically organized when we are sleeping, especially our memories and new things we have learned. And even our body, our digestive system and the entire body, it needs some rest to reorganize itself to get ready for the next day. So when you don't get an adequate sleep, everything goes awry. So particularly since I'm a neurologist, if I focus on the brain, so of course your memory becomes clouded because all your memories you are not nicely, organized in your brain. And then of course your cognition, that means, in other words, your memory and the ability to understand, ability to comprehend, and then all these things, your learning capacity, everything can be affected due to lack of sleep. On the following day itself, you will identify that. That is why even the American Association of Sleep, they all recommend 6 to 8 hours of good quality night sleep. So they just give a minimum of 6 and maximum of 8. So that is why it is important to have a good sleep of that length. And just if you burn your midnight oil, perhaps, every now and then when you get a funeral or something, that will not affect you in the long run. But if you lose your sleep due to perhaps being due to excessively busy with your cause and all, in the long term, of course, you can have perpetuating health hazards. Such as brain-related, of course, clouded memory, you call it brain fogging, and then inability to concentrate on the following day, inability to learn new things and all. And at the same time, your entire metabolism, the bodily metabolic activities might be, completely interrupted. Therefore, you can get other health issues like hypertension, high blood pressure, high blood sugar, and overall you will be, you will age pretty fast. And starting from the skin itself, nowadays the the young population and even the elderly are very much concerned about their look and everything. So an adequate hours of sleep is necessary for everything, starting from your skin care to your brain.
Thank you. That's very interesting, because not very many people pay attention to the need to sleep. Some of them, I would think, from what I know, we have to sleep, so we sleep. But the fact that you need to get to bed at a reasonable hour and you should get that amount of sleep is, I don't think, from what I have seen around me, I mean, not I'm saying around me, like what people hear, talk about, and sometimes it's work. I have to finish this report before I go to sleep. I have to email this somehow tonight. And it's a regular thing, not a one-off thing, or not a thing that happens on and off, but a regular thing.
Absolutely.
Happens, yes.
Yeah, unfortunately, we have not understood the importance of a good quality sleep. We always prioritize on now other things like our job or, entertainment over a good night's sleep. But I think in the long run, the aging process will be very much, kind of hastened if you don't get a good sleep. I think, the screen now, not like the good olden days. Now the screen time has become a really big problem, not only for the children to the youth and also to the adults. So now even what you call sleep hygiene. The sleep hygiene is pretty bad now. When patients come to us with this complaint of inability to falling sleep, we just check into their sleep hygiene. That means what they do before they go to bed, how they prepare to sleep, and then what do they do after going to bed, and how many times they wake up, and so on and so forth. So what I have realized is many people don't really go to that shutdown process well before going to sleep. So they are always looking at a screen, they are looking at their phone, and even after going to sleep, after turning off all the lights in the room, they just keep gazing at the phone. So I told you our biological clock is set by the external stimuli. So when we keep looking at the phone, we think, okay, the light is still coming. The brain think, okay, it can't be night. Therefore, the brain might not go to sleep even though you want to go to sleep. So you just keep the phone aside and shut your eyes, but the brain will not shut down. So the sleep hygiene is extremely important. As you said, of course, we have to meet our deadlines. Of course, we have to embark on our professions. But at the same time, a good sleep will be the best investment you can ever make.
A question, doctor. There are people, like you said, they go to sleep, but they don't fall asleep. It takes quite a while to fall asleep. They complain. What is the reason there related to all of this?
Yes, it is multifactorial. But I must say, you may be awake for about 20 minutes. We give a window of 20 minutes after going to bed. It's pretty normal to stay awake because, there are different stages of sleep. So there's something called sleep latency, meaning that after, closing your eyes and turning off the lights, there's a latency of 20 minutes before falling asleep. But it might take longer for some. So actually, firstly, it can be due to many reasons. But the commonest one are the poor sleep hygiene. And then, which is of course the main reason in youth. And then pain and other medical disorders might be the reason, right? And then disorganized circadian rhythm, or else what you call the biological clock. Then they might be on different drugs, drugs in the sense medications, and they might be on some other substances which might be hindering with their sleep. So I can actually bring about so many reasons as to why you might not fall asleep as soon as going to the bed, but I want to highlight the sleep hygiene and bad sleep habits as the very first one.
That sleep hygiene is yet another new term that we've come across today. We always speak of being hygienic, our hygiene in the physical sense, keeping our bodies clean and all of that. Hygiene is so important in all aspects of life, but sleep hygiene is something very new. And so it is a term that you use in your capacity as a consultant neurologist, focusing on sleep neurology.
That's right. And sleep hygiene, of course, not only by the neurologists, but also by the psychiatrists and everybody. Actually, now there's more emphasis on sleep hygiene due to the up and rise of the new technology and the social media. Because especially school-going children and young people, they spend too much on the screen, and because of that, their sleep hygiene is pretty much disrupted. That's why this term has come into the light very much.
Thank you, doctor. So, who do you see most having this problem? Is it young people? Is this the young adults or the older people?
Yeah. In our clinics, I'm not too sure about the statistics in our country, but in the practical setup, most of the people with lack of sleep or inability to fall asleep are elderly, those who are particularly after 70 years. Because our biological clock, just like in newborn, I mentioned you earlier, when we get old also, our biological clock gets disrupted. Just like any other part of your body, the biological clock or our brain hypothalamus age, right? Therefore, they tend not to identify daytime, they tend to miss the night time likewise, so they find it really difficult to fall asleep. And when you age, you have other problems. You have aches and pains, you have many other diseases interrupting your sleep, and you might be on multitudes of pharmacological medicines which might be interrupting your sleep. And at the same time, in the daytime, you might be really, they might be really inactive. All these might be contributory to not being able to fall asleep in elderly. So most of them, I must say, elderly, but unfortunately we are coming across a handful of young people as well, finding it difficult to fall asleep, mainly due to poor sleep hygiene, poor sleep habits.
Would you say that exercise plays a role or an important role in helping a person to sleep? Because when you take the elderly, and you did say that they may not be as active as the younger people, some of them are very focused. They go for walks, or they do something, some physical activity to keep themselves going, and as against the younger people. But would you say that exercise will help towards having a good night's sleep?
Absolutely. So talking about sleep hygiene, I just talked about all the bad things which might be hindering falling asleep. So if I focus on the good things which will be helping sleep hygiene, exercise plays a major role, not only in elderly but also in young people, because I told you our biological clock is set by external stimuli. So when you exercise, when you become very active, one thing is you feel tired, right? Then of course your brain and the body need some rest. So that makes it easy for you to fall asleep. And at the same time, it is a signal to the brain, to our biological clock, okay, this is day. So this is the daytime, I am active at this point. So then in another few hours will come the night, and I must sleep at that point. So it will help to regularize the circadian rhythm, or to regularize the biological clock. And apart from that, physical activity is extremely important for children, because now due to the competitiveness in the schools and everything, children might be away from being very active, doing a lot of sports and all. They might be focusing a lot on their education. But I think for the children and also for young people, it's extremely important to be active in the daytime, to do a lot of outdoor exercises where you get exposed to sunlight as well, to regularize your sleep and for you to get a good quality night's sleep.
What is the extreme situation in this respect? I mean, how does it impact really the negative sense?
In the sense,
the lack of sleep.
Yes. As I mentioned before, lack of sleep can, of course, affect your cognition, or in other words, your communication, your understanding, learning, memory, and everything. And at the same time, lack of sleep will have a negative impact on your overall health. You can be, have high blood pressure, and then problems with your digestive system and everything. And now there are some researches being done on lack of sleep on other more serious illnesses like heart attacks and strokes, so on and so forth. And overall, as I've told you before, a person might age pretty soon if they don't get a good sleep. Aging, starting from the skin deep into your other systems.
Doctor, what about medication? Because some people are put on certain medication to sleep.
Yeah.
And then after a while it stopped. Would there be an addiction if it's continued, the medication?
Yeah, this addiction, of course, is a question asked by many patients who are coming to us. But I must say that there are different kinds of medications which can help you fall asleep. Some, of course, if I talk about certain medications where the addiction risk is pretty less, something like melatonin. Melatonin is a hormone in our brain which is secreted from the brain, which of course it's a chemical which is regularizing our circadian rhythm, or which is setting up our biological clock. Melatonin is a chemical which is coming out of our brain towards the evening. It's kind of a chemical signal to our brain to shut down, right? So now there are biological preparations to give it from outside, to help certain people to fall asleep. Generally, it has very less, addictive potential, since it is actually something naturally occurring in your brain. But there are certain other sedatives like benzodiazepines and all. Of course, what happens is for the first few months or so, you will easily fall asleep with the help of those pills. But later on, as you said, it's all about chemicals. So our brain might get used to that particular dosage of medicine, so the brain will need more higher doses of the particular medicine to fall asleep. Likewise, actually, yes, there can be some risk of what you call tolerance and addiction. That is why we always recommend sleeping tablets to be taken under the prescription of an experienced and a registered practitioner. I think treating these sleep disorders with medications should be done extremely carefully by experienced doctors.
Thank you, Doctor. Time has caught up with us.
Okay.
What's your take-home message?
So my take-home message is a good quality sleep is the best investment you can make on your life and also on your overall health. So prioritize it.
That's short and to the point. Thank you so much, Doctor.
Thank you.
And that we end this very interesting discussion on sleep neurology. To Dr. Shania Gunasekera, consultant neurologist at the Institute of Neurology, National Hospital of Sri Lanka, we say thank you. Thank you very much for being with us on the program. Thank you too to Prabha Veerasuriya for technical assistance. I'm Fatima Razikad, bidding you good night and looking forward to your company next Monday, same time on Views on Health.